Hi, and welcome to Asian Watch. Today, we're diving into a very serious and important topic: depression. It's a condition that affects millions of people, often silently, and understanding it is the first step toward healing and hope. Depression is often invisible to the outside world. Behind quiet smiles, people can be fighting battles no one else can see. It isn't just a moment of sadness, but a heavy, lingering weight. So today, we're going to talk about depression honestly, completely, and without judgment. It's more than just feeling down. It's a serious mental health condition that affects how a person thinks, feels, and functions every single day. Millions of people experience it worldwide, often in silence. So, what is it really? Depression is a medical illness deeply connected to brain chemistry and emotional regulation. It is not a weakness, it's not laziness, and it's certainly not a lack of gratitude. Anyone can develop depression, regardless of their age, gender, or level of success. It often develops so gradually that it goes unnoticed for a long time. Many people with depression don't just feel sad, they feel empty. Joy, motivation, and interest can slowly fade away from daily life. Simple tasks, like getting out of bed or making a meal, can feel exhausting and completely overwhelming. The mind becomes heavy, foggy, and emotionally numb. Let's break down the emotional and mental symptoms. A persistent sadness or low mood that lasts for weeks or even months is a key sign. Feelings of hopelessness, guilt, or worthlessness can become constant companions. You might also notice increased irritability and emotional sensitivity, seemingly out of nowhere. Many people feel disconnected from others and even from themselves. The physical symptoms are just as real. Depression often causes chronic fatigue and a profound lack of energy. Sleep can be disrupted, leading to either insomnia or sleeping far too much. Appetite can also change, causing significant weight gain or loss. Unexplained aches, pains, and headaches are also common. Cognitively, concentration and memory can become noticeably impaired. Making decisions can feel slow and confusing. Negative thoughts can start to repeat automatically and relentlessly, like a broken record. The future might appear bleak and meaningless. These internal struggles naturally lead to changes in behavior. People may withdraw from friends, family, and social activities they once enjoyed. Work, school, and other responsibilities begin to suffer. Hobbies and passions no longer feel rewarding or interesting. For many, avoidance becomes a primary coping mechanism. It's also important to know that depression isn't a single, uniform illness. There are several different types. Major depressive disorder involves severe, long-lasting symptoms. Persistent depressive disorder, or dysthymia, is milder, but lasts for years. Seasonal affective disorder appears during specific seasons, usually winter. Postpartum depression occurs after childbirth. And bipolar disorder includes episodes of both depression and mania. There's also situational depression, which follows major life stresses, and atypical depression, which can involve mood reactivity and oversleeping. In severe cases, psychotic depression can include delusions or hallucinations. So what causes it? It's complex and usually a combination of factors. Brain chemicals like serotonin and dopamine play a huge role. Hormonal imbalances can also trigger depressive symptoms. Genetics can make some individuals more vulnerable. Chronic illness and certain neurological conditions also raise the risk. Life experiences are just as critical. Trauma and unresolved emotional pain contribute significantly. Low self-esteem and a tendency toward perfectionism can increase susceptibility. Negative thinking patterns can reinforce depressive cycles, creating a feedback loop that's hard to break. Early childhood experiences shape our emotional resilience later in life. Long-term stress can completely overwhelm our coping mechanisms. Our social environment matters immensely. Loneliness and a lack of support can intensify feelings of depression. Abuse, neglect, or toxic relationships can cause deep emotional harm. Financial hardship and job insecurity add enormous pressure. It's also crucial to mention that while some people turn to alcohol or drugs to escape emotional pain, this often deepens the depression over time by disrupting brain chemistry. Diagnosing depression is a job for trained mental health professionals. A diagnosis is typically made when symptoms persist for at least 2 weeks. The process also involves ruling out other medical conditions that could be causing the symptoms. Honest communication with a doctor or therapist is absolutely essential for an accurate diagnosis. The good news is that depression is treatable. Talk therapy is a cornerstone of recovery. It helps people identify and change harmful thought patterns. Cognitive behavioral therapy, or CBT, teaches healthier coping skills. Psychodynamic therapy explores underlying emotional conflicts from the past. Therapy provides validation, a sense of structure, and a deeper understanding of oneself. Medication can also be a powerful tool. Antidepressants work to help balance brain chemistry. They usually take several weeks to show their full effects, and it's important to be patient. Side effects can vary and require medical monitoring, so it's vital to work closely with your doctor. Medication often works best when it's combined with therapy. Lifestyle changes can make a huge difference too. A regular sleep schedule supports emotional stability. Physical activity is a natural way to boost mood-regulating chemicals in the brain. A balanced, nutritious diet fuels brain health. Creating a daily routine provides much-needed structure during recovery. Practices like mindfulness and meditation can reduce rumination and quiet a racing mind. For seasonal depression, light therapy can be very effective. In very severe, treatment-resistant cases, electroconvulsive therapy may be used, and new treatments are always being researched. Let's clear up some common myths. Depression cannot be cured by willpower alone. Talking about it does not make it worse, it makes it better. Strong people can and do experience depression, and asking for help is a sign of strength, not failure. We need to talk about suicide. Some people with depression experience suicidal thoughts. These thoughts are a signal of intense pain, not a character flaw. If this happens, immediate help is critical. Support and treatment can and do save lives. If you know someone who is struggling, how can you help? The most important thing is to listen without judgment and without trying to fix them. Gently encourage them to seek professional help. Check in consistently, even if they don't respond right away. Sometimes, just knowing someone cares can make all the difference. Your presence matters. Recovery is possible, even after years of struggling with depression. It's important to remember that progress isn't always a straight line. There will be setbacks, and that's okay. Small improvements matter deeply. Healing takes time, patience, and support. Many people learn to manage their depression long-term and lead successful, fulfilling lives. Self-compassion is essential, especially on difficult days. Life can still hold meaning and connection. If you or someone you love is struggling, please know that help is available. Reaching out can feel incredibly hard, but it is a powerful first step. Depression does not define who you are or who you can become. You are not alone, and hope is always within reach. Thank you for listening. Please remember, this video is for general informational purposes only and is not a substitute for professional medical advice. If you are in crisis, please contact a local emergency service or a mental health hotline. Thank you for watching Asian Watch. Please like, share, and subscribe for more important conversations.